بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. Welcome to Lecture 7, the current trends and emerging technologies. In the previous lecture, we introduced the electronic health records and their use, described the fundamental components and procedures of health information systems, implement confidentiality and security procedures to protect electronic health information. However, in our lectures today, we are going to shed a light on current and emerging technologies which may affect healthcare quality and patient safety, informatics, consumers. We also raise some challenges that could affect such technologies, such as electronic health, patient portals, mobile health, and Internet of Things. The learning objectives of our lecture today is by the end of this lecture, the student will be able to identify the new health technologies and they should be relate and discuss to the current technologies advancement. Some of the technologies that will be discussed in this lecture are electronic health, patient portal, and health apps, mobile health apps, telehealth and telemedicine, and the difference between telehealth and telemedicine, personal health record, mobile health, and we are going to have some examples on the new health technologies such as artificial intelligence, robotics, blockchain, and Internet of Things. Electronic health, digital health. So what's the electronic health? What's the role of electronic health, digital health in healthcare delivery and patient safety? I think all of you recognize the significance of electronic health and digital health in COVID-19 pandemic crisis. So as we know, some countries have leveraged the predictive power of big data to keep the global spread of the pandemic in check. So this is just one of many examples of how technology can be widened under the banner of electronic health to healthcare for and save millions of people around the world. So what we all know for sure is that if people are to live longer and better, we will have to depend on research and technology. So the same combination that has been managed to contain the COVID-19 pandemic worldwide. Okay, so the healthcare sector has been flying into a digital revolution with technology working its way into every process. So the concept of digital health or electronic health emerged to designate the use of information and communication technologies in healthcare sector, equipping it with cutting-edge resources to ensure more efficient management and optimized diagnosis, definitely a better patient care. This includes innovations in a whole host of areas such as doctor-patient communication, research, and hospital management. So what's the definition of electronic health? So electronic health uh, defined as an emerging field in the intersection of medical informatics, public health, and business, referring to health services and information delivered or enhanced through the internet and related technologies. In a broader sense, the term characterizes not only a technical development, but also a state of mind, a way of thinking, an attitude, and a commitment for networked global thinking to improve healthcare locally, regionally, and worldwide by using information and communication technology. So, according to the World Health Organization, electronic health is the use of information and communication technologies for health. Examples include treating patients, conducting research, educating the health workforce, tracking diseases, and monitoring public health. So, in other words, digital health is about electronically connecting up the point of care so that health information can be shared securely. So this is the first step to understanding how digital health can help deliver safer, better quality of health care. Patient portals. So the patient portal the advancement of technology has changed the practice of medicine. It has evolved the physician-patient relationship from a face-to-face interaction into real-time online encounters, from emails to virtual appointments. Patient portals represent such a technological advancement. So what's the patient portals? So patient portals is defined as a secure online website that gives a patient convenient 24 hours access to personal health information from anywhere with an internet connection. Using a secure username and password, patient can view health information. So what's the health information that can the patient see in his patient portal? Example, such as recent doctor visits, discharge summaries, medications, immunizations, allergies, and the laboratory results. Portals also allow patients to exchange secure email with the healthcare teams and even request prescription refills, schedule non-urgent appointments, check benefits and coverage, update contact information, make payments, download and complete forms, view educational materials. So other electronic health is the health apps or mobile health apps. So I think all of you is familiar with the mobile apps, and I think even in health apps. So mobile health is gaining steam among consumers as Apple and Google continue to offer a range of mobile health applications on their app stores. there were more than 300,000 mobile health applications available for download worldwide. Some of the most common categories of mobile health apps include health apps about diabetes, pregnancy, weight loss, and chronic illness. So by having a mobile apps dedicated to health turns our smartphones into personal trainers, sleep monitors, diagnostic devices, and more, with apps for both healthcare professionals and patients. So some of the most common category, as I mentioned before, of mobiles health apps include diabetes, pregnancy, weight loss, chronic illness. What's the benefit of using mobile health apps? So the stakeholders across the healthcare industry are looking to tap into the mobile health opportunity, as mobile health applications are beginning to integrate electronic health records in order to provide a detailed representation of patients' health or medical history. Also, healthcare providers could reduce appointment costs by taking advantage of mobile health applications, which lower the risk of patient rehabilitation. So, for example, instead of staying in a healthcare facility post-surgical discharge, patients could utilize mobile health applications for recovery instructions and medications reminders. So finally, health insurance providers could develop mobile applications that provide consumers with health education and send reminders to purchase healthy food, keeping patients largely responsible for their own health care. So some of the examples of mobile applications in health is we have Hakim in Jordan, and we have, I think, Aman applications, which Ministry of Health use it to contain COVID-19. So this application can help in tracking infected people and the people who's in contact with people who are already infected with COVID-19. And other applications such as the Child Health in Australia, which is personally controlled electronic health record, and MedCap, medical information for healthcare professionals, and phase 2 gene smart phenotyping of genetic evaluation. However, there's some disadvantages of poorly constructed mobile health applications. So when talking about mobile health applications, we need to be careful to understand that this is not the desired point of digital healthcare. A small number of these applications have the potential to transform the health system. Many are not particularly helpful, and a large number are considered as rubbish. So some of the impact of poorly constructed mobile health applications are overdiagnosis or self-diagnosis, solid data, and damaging relationships with health providers. So in case of overdiagnosis, through constant monitoring of personal health data, there is a risk that some health consumers become hyper sensitized to small changes in data values. For example, patients recording their own blood pressures may become overly concerned about values that slightly or briefly rise above recommended levels. Okay, this could result in self-diagnosis without the application of appropriate clinical knowledge and an understanding of context. While for the self-diagnosis, armed with large amount of increasingly democratized medical knowledge, there is a very real risk that patients will use this in inappropriate ways and in the wrong context. This can and does unfortunately lead to patient self-diagnosis conditions with unhelpful and sometimes serious consequences. Siloed data. Many mobile health apps store data on the mobile device on which they run. This data is then locked in yet another health information silo, with little ability to be integrated with patient health record or to be viewed or actioned by health care providers. This risks making the challenge of fragmented health information even worse. And the last impact of poorly constructed mobile health application is damaging a relationship with health providers. Inappropriately overconfident patients can experience a deterioration in their relationship with health providers. Significant frustration can be experienced on both sides when patients self-diagnose or become convinced that certain treatment should be applied. So the intersection of medicine and technology can be confusing place. Policymakers, vendors, and advocacy groups often use imprecise language or throw out technical terms inconsistently. They were guilty of this from time to time. Although the terms telemedicine and telehealth are often used interchangeably, there is a distinction between them. So the definition of telehealth and telemedicine and the difference between both terms are going to be explored more in the next slides. So what's the Health Resources Services Administration defines telehealth as the use of electronic information and telecommunications technologies in order to support long-distance clinical health care, patient and professional health-related education, public health, and health administration. Technologies include video conferencing, the internet, store and forwarding imaging, streaming media, and terrestrial and wireless communication. So telehealth is different from telemedicine because it refers to a broader scope of remote healthcare services than telemedicine, while telemedicine refers specifically to remote clinical services. Telehealth can refer to remote non-clinical services, such as provider training, administrative meeting, and continuing medical education, in addition to clinical services. So telemedicine differs from the more general concept of telehealth. The American Telemedicine Association offers the following definitions of telemedicine as the use of medical information exchanged from one site to another via electronic communications to improve patients' health status. Closely associated with telemedicine is the term telehealth, which is often used to encompass a broader definition of remote healthcare that does not always involve clinical services. Video conferencing, transmission of still images, electronic health including patient portals, remote monitoring of vital signs, continuing medical education, and nursing call centers are all considered part of telemedicine and telehealth. So the centers, also the centers of Medicare and Medicaid services define telehealth as the use of telecommunications and information technology to provide access to health assessment, diagnosis, intervention, consultation, supervision, and information across distance. Telehealth includes such technologies as telephones, facsimile machines, electronic mail systems, and remote patient monitoring devices, which are used to collect and transmit data for monitoring and interpretation. So, telehealth and telemedicine, as we can see, is that telehealth is in the figure. Telehealth is usually broader than telemedicine, and telemedicine considered as a sub heading of telehealth. So telemedicine offers patients and providers benefits that include reduced healthcare costs, increased patient access to providers, especially in medically underserved areas, improved quality and continuity of care, faster and more convenient treatment, resulting in reduction of lost work time and travel costs for patients. Now we are going to talk about the privacy of patient privacy and security, patient information privacy and security during the telemedicine or telehealth. So with telehealth, every component of the care delivery infrastructure is electronic in some form. Compliance with privacy and security requirements and strong information governance must be part of systems design. So when electronic information is transferred, video conference is involved, or digital photos are transmitted, it's the responsibility of both the providers and telehealth company to maintain compliance with regulation of patient privacy and security, or in securing patient privacy. Because system components are often a hybrid of cloud and facilities-based product and services, surveillance or monitoring is necessary to ensure compliance, protect patient information, and withstand the privacy or security audit. Health information professionals' skills are needed in order to document the flow of information from virtual visit system across a health information exchange or into an electronic health records. So electronic health records and document. Electronic health records and documentation. Having a digital health record means information can be stored in one place but be available anywhere. So patients can share it safely and healthcare staff can access it at any time. So interoperability between virtual visits providers and traditional medical record keeping systems presents a significant hurdle and area for opportunity. Uh, in an ideal scenario, information about the patient would be transmitted electronically, coded for reimbursement, and added to patients' overall record in real time. Okay. But currently, this is not the case. Today's telehealth providers maintain records on individual consults, follow-ups, and patient history within their own telehealth system. There is no automatic mechanism in place to exchange virtual visit details with patients, other providers, physicians, hospitals, or health system. So one workaround provides patient access to a report of the virtual visit so the patient can then share it with the primary care doctor. Like with personal health records, this strategy places the onus on the patient for managing and sharing information. So until interoperability is a reality, organizations like Commonwealth Health Alliance are bringing together technology companies, electronic health vendors, healthcare organizations, and other stakeholders to tackle industry-wide connectivity and communication issues. Coding visits and reimbursement. Another challenge is reimbursement. Reimbursement differs by payer based on two factors. Is the service offered by an insurer or is it the patient on Medicare, or is the service privately funded by an employer? So contracts contracts are in place between some telehealth providers and insurers, but there is no single system for reimbursement. Also, many employers offer telehealth option directly to their employees and fund effort themselves or work directly with the insurance providers. So the significance of this link, an example of the significance of this linkage between between the telehealth options and the insurance companies. When an employee has a sick child, for example, or is feeling ill, wait times for a face-to-face appointment can be several days or weeks. This requires time of work to drive to the appointment, sit in a waiting area, and finally see a physician. Okay? Personal health record. A personal health record is defined as an electronic application used by patients to maintain and manage their health information in a private, secure, and confidential environment. Personal health records are managed by patients, can include information from a variety of sources, including healthcare providers and patients themselves, and also can help patients securely and confidentially store and monitor health information, such as diet plans or data from home monitoring systems, as well as patient contact information, diagnosis lists, such as medication lists, allergy lists, immunization histories, and much more. The personal health records are separate from and do not replace the legal record of any healthcare providers. Finally, the personal health records are distinct from portals that simply allow patients to view provider information or communicate with the providers. For mobile health, which is also known as mHealth, as abbreviation, wearables devices. The mobile health, as mentioned previously, I mean in the previous lecture, I think in lecture 5, mobile health is increasingly being used by many. We are living in a digitally connected world. Mobile has quickly become the channel of choice for customers to interact with brands and services. And the trend is speeding into more areas than just social media and e-commerce. Healthcare companies have answered the call to mobile and are making their services increasingly more available to the mobile-first consumer, bridging service straight into the palm of their hand. In order to envisage a better, more transparent, safe, accessible, sustainable, and efficient health system than we have today, we must lift our vision above the siloed mobile health application as the building block of future improvement. Seen correctly, mobile applications are the current delivery channel of choice for new digitally enabled models of care, but not the solution on their own. So, the mobile application is only inherently a good thing in that it allows us to reach into the pocket of the health consumer, allowing the creation of a two-way digital channel. Through this channel, we can monitor patient behavior, apply clinical decision support, interact with patients and their carers, and seek to modify health behaviors. Uh, but these benefits only come into play when we connect patients, carers, and clinicians in a complex, interconnected network. Mobile is a necessary part of these emerging networks, but it's not sufficient. So deliberate design is required to ensure that appropriate subsets of patients' gathered data are made available to clinicians at the right time in a way that does not make their job harder, overwhelm them, or lose the data signal amongst the noise. Okay. Advancement in mobile have both consumers and healthcare workers better ways to track and record vital signs such as glucose levels and blood pressures, access patients' records, uh, deliver important educational information to patients, and provide alert notifications and updates directly into a user's pocket. Uh, 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 Wearables devices. So the well-known term wearables includes smart clothing, as we can see in the figures, and accessories such as wristbands, glasses, watches to monitor and collect information on our health and physical condition. Wearables, they are edging into the consumer markets with a hefty price tag, although at present wearables are largely considered a fashion accessories according to Deloitte. This technology is a prime for the healthcare sector where hands-free heads-up awareness is essential. Many of the more advanced technologies of wearables are being developed first for the enterprise and healthcare segments, which have clearer use cases. Uh, 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 the success or failure of these products depend on, as we know, connecting humans so closely to technology is a risky business. So in this new context, the success or failure of these products depends on the customer experience. Achieving success, therefore, depends on application developers' ability to create programs that will win over potential users. For the moment, and in view of global wearables sales, it's fair to say that wearables are doing a great job. So, uses of wearables. So, wearables can track what you see, your pulse, your breathing rate, how long you sleep, and even when you are feeling well or stressed out. They also encourage good eating habits and health. So the industry produces different type of wearables, from wristbands, necklaces, rings and earrings, to garments, and of course wrist watches. Uh, these devices have been a massive success. Uh, we have some examples of wearables. The mind-car connection and how it works. The first one is the mind-car connection. So the brain is still the least understood organ of the human body. A helmet with sensors that detect changes in brain waves could change all that. With the information obtained, decoding algorithms will be created to connect drivers' minds with their cars. The cardiac control to prevent arrhythmia. Arrhythmia can have serious consequences, most of which are avoidable. To deal with these problems, a garment containing electrodes has been developed. It is less invasive for patients and requires neither wires nor adhesives. And finally, the final example of wearables devices is locating the elderly. Elderly people and those in early stages of Alzheimer's disease are at risk of becoming lost. To avoid this situation, allocating devices a device has been developed with an SOS button to use in case of an accident. So these are an example of using some wearables. Hot products already entering the health wearables market, all featuring Google Glass, include uh, the augmented reality. Augmented reality can help a health professional to visualize organs in 3D, for example, or check patients' record in real time. It can even be used in surgical procedures with special augmented reality headsets. And Augmedix, an American startup, is using Google Glass as a data management and display system for doctors. They can then tap into these records when they need them, for example, when examining a patient. Uh, Wearable intelligence, this is an application for the therapist rather than the patient, and GAIN incorporates Google Glass. The app walks the therapist through exercises for the patient and gives instruction on things such as rotation and angle of flex. It also incorporates recording video footage and affirms when the exercise has been conducted correctly. Uh, the big difference compared to smartphone, the big difference between the wearables and the smartphone is that the wearables are worn on our bodies, freeing up our hands. They can even be right on our skin. For example, uh, Vivalinks, a health sector company that creates wearable solutions to monitor people's vital signs and biometrics, uses eSkin to insert in an electronic chip in an adhesive patch that communicates with patients' tables or mobile phones. Artificial intelligence, although still at a very early stage, artificial intelligence is laying the foundation to lead a revolution comparable to that generated by the internet. Artificial intelligence is the combination of algorithms formulated for the purpose of creating machines that have the same skills as a human being. This is a technology that still seems to be distant and mysterious, but one which has been a constant presence in our day-to-day lives for some years now. Artificial intelligence can help healthcare professionals to make wiser decisions and deliver better treatments. During the coronavirus crisis, for example, artificial intelligence was used to identify the sequence of antibodies and its compatibility with future treatments. So, artificial intelligence is defined as the science and engineering of creating intelligent computer systems that are able to perform tasks without receiving instructions directly from humans. These computer systems use a number of different algorithms and decision-making capabilities, as well as a vast amount of data to provide a solution or response to requests. Uh, Artificial intelligence could be used for personal health virtual assistant, advanced analytics, and research, and personal life coach. The most famous artificial intelligence in healthcare is the IBM Watson Health Smart Cloud platform, which is aimed at translating information into knowledge. Uh, Anytime a new technology enters healthcare, there are a number of challenges it faces. Common setbacks of artificial intelligence in healthcare include a lack of data exchange, regulatory compliance requirements, and patient and providers adoption. Robotics uh, The term medical robot encompasses robots that are applied in the medical science. They include, but are not limited to, surgical robots. There are in most telemanipulators which use the surgeon's action on one side to control the effector on the other side. The robots are being used in many ways in the field of healthcare, such as in the surgery and nurse assistant to draw blood, and in the telehealth, disinfectant robots, ingestible microbots, and pharmacotics. Uh, Blockchain is a distributed database that maintains a continuously growing list of data records that are hardened against tampering and revision, even by operators of the data store nodes. The most widely known application of a blockchain is the public ledger of transactions for cryptocurrencies such as Bitcoin wallet. It could be used in banking, marketing, voting, medical records, and smart contracts. Smart contracts in healthcare could do things such as trigger an insurance payment to a doctor when a patient undergoes a CT scan. Mm. Blockchain could also be a secure place to store electronic medical records. It would detail all patient-doctor communication, illness and treatment information, vaccination records, medical bills, etc. Every subsequent doctor visit or treatment would be added to the blockchain, including those in different cities and countries, creating a complete historical record of patients' health. In this case, the blockchain is private and only certain participants would have the encryption keys to see the record. According to reports, any medical records and data may be encoded into the blockchain and transacted, validated, or preserved in a much more efficient manner than at present. Personal health records may be stored and administered by blockchain. Once such data is recorded and confirmed on the blockchain network, it's nearly impossible to modify or erase the information. Besides, users such as a doctor and other parties will have devices with key permissions into the records. The benefits of blockchain, one of the benefits of blockchain technology includes improving data integrity and security through enhancement of data management of electronic health records, health information exchange, and medical insurance claims. Another benefits may include an opportunity for improving quality standards when managing healthcare records, insurance claims, and patient medical data. Additionally, blockchain technology could optimize the relationship between healthcare and insurance companies. Internet of Things. The Internet of Things helps to customize healthcare, save costs, reduce the likelihood of incorrect diagnosis, and shorten waiting times. The connection between the physical and digital world will be crucial in equipment such as inhalers and audiometers. So what's the Internet of Things? So Internet of Things is defined as a system of interrelated computing devices, mechanical and digital machines, objects, animals, or people that are provided with a unique identifiers and the ability to transfer data over a network without requiring human-to-human or human-to-computer interaction. So, in a simple word, this is the concept of basically connecting any device with an on and off switch to the internet and or to each other. This includes everything from smartphones, coffee makers, washing machines, headphones, lamps, wearable devices, and almost anything. The Internet of Things is a giant network of connected things, including people. The relationship will be between people to people, people to things, and things to things. So, for example, you are in your way to a meeting. Your car could have access to your calendar and already know the best route to take. If the traffic is heavy, your car might send a text to the other party notifying them that you will be late. What if your alarm clock wakes up you at 6 a.m. and then notifies your coffee maker to start doing coffee for you? What if your office equipment know when it was running low and supplies and automatically reordered more? What if the wearable device you use in your workplace could tell you when and where you were most active and productive and share that information with other devices that you use while working? So, accordingly, Internet of Things provides a revolution in data, which is empowering people to live healthier lives by using connected devices such as tablets, wearables, and handheld devices. This this Internet of Things means that consumers now have the power to take control of their own health in a highly personalized manner. Uh, so the analysis of this data amassed through electronic medical record, diagnostic information gathered through imaging equipment, monitors, and handheld personal devices enhances the decision-making powers of professionals and enable patients to take a more active role in managing their personal health. These innovations are transforming not just the care of chronically ill, but those who are and want to remain healthy. For example, in an Internet of Things, a company called Lipilium is developing Internet of Things platforms for smart cities. For instance, it created a biometrical Internet of Things platform that allows developers to easily create new software, electronic health applications, and medical devices measuring 20 different body parameters. It recently released my signals, as you can see in the figure, the most complete electronic health development platform with 15 different sensors that measures the most important body parameters, such as the ECG, glucose, airflow, pulse, oxygen in blood pressure, etc. All the biometric data is encrypted and sent to the Lipilium cloud in real time to be visualized on the user's private account. So now the question that we are going to ask ourselves about is, what's the advantages and benefits of previous technologies and electronic health? Uh, the first advantage is it's improved in patient monitoring. How that happened? Communication is easier with this new digital channel, helping to bridge the gap between doctors and patients. Technology also means the patient condition can be monitored and their progress can be recorded in real time. The second advantage is more informed patients. So a patient can make better health decisions when they understand their diseases and have the power to manage their own health. Information and communication technologies also provide patients with access to guidebooks and best practice, something very useful. For instance, during the pandemic, if they come from reliable sources. The third advantage is encouraging healthier habits. So new technologies are changing the way we look after ourselves with applications and devices that keep track of what we eat, how much exercises we do, how long our sound we sleep, and how fast our heart rate is. The fourth advantage is easier decision making for healthcare staff. So electronic health is also transforming the way professionals deal with disease. Information and communication technologies can help, for instance, to identify optimal treatment more easily or detect illness at an early stage. The fifth advantage is more accessible and equal healthcare. Access to healthcare is no longer limited by time and space, which means avoiding unnecessary travel. Moreover, technology brings healthcare to more people, especially patients at risk of exclusion, which means more equal opportunities for everyone. So the last advantage of the previous technologies and electronic health is more efficient hospitals and health clinics. As we know, connected facilities mean a streamlined health system, minimize the chance of a human error, and cutting costs. In addition, techniques such as big data processes are being automated. So, despite the significant advantages for the utilization of previous technologies as part of healthcare information technologies, there are serious challenges and barriers to their implementation. What are these challenges? The next slides will mention some of these challenges that face technologies. So some of those challenges and barriers are cost, security, privacy, reliability, integration, data portability, and finally interoperability. These are references that I use for this lecture. Thank you for your listening. This is the end of our lecture, and I hope you find it nice, simple, and interesting. Uh, 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 the next lecture will be the final lecture, and it will be about evaluation research, about the research and in general, and evaluation research in health informatics. So thank you again for your listening, and bye for now.